Metastatic brain tumors, the reason we treat them with Gamma Knife is that typically most of the medications that are used to control, say for instance, someone has a lung cancer and it's felt to be a candidate for what's called immunotherapy and or chemotherapy or both. Oftentimes those tumors are treated with both. Those molecules that are in those medications are really large and they don't penetrate very well into the brain. The blood vessels in the brain are protected by something that's known as the blood-brain barrier. And what that does is it prevents large molecules from getting out of your bloodstream into your brain. Simple things like sugar, alcohol go right through. Larger, complex particles, drugs, pharmaceutical things don't make it through. So there are a few chemotherapies that can penetrate in the brain to a dose that can affect tumor control. But for the most part, when a tumor is in your brain, chemotherapy is usually not the front or first line option. Radiation or surgery is. And so Gamma Knife is a way to utilize a focused beam of radiation to a tumor in a way that will just do enough damage to the tumor cells that they'll die, but the surrounding brain tissue will not. Up until the advent of radiosurgery, that was just treated either with surgery, which you could do if it was one lesion, or if the patient had multiple lesions, it was done with what was still done with radiation, but it was called whole brain radiation. It wasn't particularly precise, it was effective, but you were radiating the whole brain. And the difference between Gamma Knife and whole brain radiation is Gamma Knife is really only delivering radiation to where the tumor is, to any degree that would cause any damage. Whole brain radiation delivers the same dose of radiation to the whole brain. So it's enough to kill the tumor cells, but unfortunately, if the patient survives long enough, which is the goal for all people taking, cancer patients, is to get them to survive as long as they possibly can. But if you do whole brain on someone, then if they live longer than a year, most of them start to have some side effects from the radiation. And the most common side effect is just sort of a cognitive slowdown, something that sort of mimics what it looks like what happens when someone develops dementia. So they just become impaired in their thinking and their processing, and they just slow down. And so as much as we can, we try to avoid giving people whole brain radiation because those drugs that I mentioned earlier, the chemotherapy drugs, the immunotherapy drugs, have taken cancers that previously, when they were stage 4, where the survival was measured in months, now the survival can go on for many, many years. With that in mind, we try to avoid the toxicity of radiation treatment, and Gamma Knife is really effective at preventing radiation brain-related toxicity. It's not like everything in medicine, it isn't 100%, but it is far less toxic than whole brain radiation when it can be utilized. So we try to use it as our preferential treatment for all those tumors. There are some limitations. Size is one of them, and the number. So it's hard to do Gamma Knife on someone who has, when the radiologist says too numerous to count brain metastases, then oftentimes we just can't tackle that. But if there's someone who has we've treated up to 15, 20 tumors in one patient if they're small enough. Every time we sort of think to ourselves that this is not an appropriate candidate for Gamma Knife, particularly with our newer device, this Esprit device, and what we had before, the Icon device, we found that we actually can treat people that heretofore radiosurgery was not felt to be the right thing to do. We've been able to do it with great results. So and the nice thing about Gamma Knife too is that there are certain tumors, metastatic rectal carcinoma to the brain, and traditional radiation doesn't work in the brain. When that goes to the brain, it's not particularly effective to do whole brain radiation. It's what's thought to be a radio-resistant tumor. But for whatever reason, radiosurgery for these tumors is more effective. So the 3 tumors like rectal cancers, renal cell cancer, and melanoma, which historically were not traditionally responsive to whole brain radiation, respond incredibly well to radiosurgery.